My name is Dr. Kay Hubbard. I'm an ND MA in clinical psychology, and I have the privilege of introducing a great colleague and friend, Douglas Valdez. Mr. Valdez is completing a master's in clinical psychology, but he already holds a master's degree in traditional Chinese medicine and an MBA. In February of 2023, so just next year in a few months, he'll be launching his private practice, Curativo Health. But you can follow it right now. You can follow that journey on Instagram. So be looking for that. We'll make sure that it's in the chat. And also his upcoming book release, which will be called Working Through Grief, a personal guide to recovering from a broken heart. That's going to be announced on his IG page, so make sure that you're following. So without further ado, please join me in welcoming Douglas Valdez to the Symposium Center Stage to enlighten us on Chicanx Healing.
Thank you so much, Kay. I appreciate that. Such a great introduction. It's amazing. Good morning, everyone on the West Coast. Good morning, everyone, or good afternoon, everyone on the East Coast. Thank you for attending this session. So let's see, Chicanx Healing and a combination of culture, medicine, healing, and therapeutic practices. So what does that mean and why I chose that? So that's a very important topic to me. Having I am Chicanx. I identify as Chicanx, American-born from Mexican parents, growing up in California, where there's a big Chicanx population. And I will go into kind of a little bit more about that as we go through the production. But I did want to talk a little bit about initially, as a person who grew up around herbal healing and herbal medicine with my mother, and as we all, some of us know who are Chicanx or Latinx, however you identify, all the different herbal remedies and treatments that we've had growing up. Of course, this isn't herbal, but you know, Vicks Vaporub, when we think about that, immediately, that is something that comes to mind. There's plenty of memes about it, but it's something that's kind of been generationally passed on. It's not herbal, but you know, of course, there's some mint and things in there, but it is not necessarily herbal, but it's just one of those healing practices that kind of goes from generation to generation to generation, and it moves along, and we carry it with us, whether we're born in the US or born in another country, because it's part of our core healing practices. And my goal is to really talk about different medical and healing practices, specifically curanderismo, yerbismo, more of traditional indigenous healing practices that went on and are still going on now. And I want to tie in a little bit of Chinese medicine, because surprisingly, there's a lot of similarities in treatment practices. And there are a lot of people who use a lot more natural healing practices. I know that there are naturopathic doctors and there's green medicine. We'll talk a little bit about that as we go on. But it's important to be aware as clinicians, as mental health clinicians, even though it's out of our scope, obviously, to maybe recommend or suggest herbal supplements or any kind of herbal healing. It is important to know kind of what your clients are showing up with, especially if you are treating people who specifically use natural healing. I am going to share my title slide a little bit just so you all can see that and not just my face. Bear with me, technology, I love you, but sometimes you don't me. See here. See that? See if I can make it a little bigger. Can you all see that? Okay. Alrighty, so let's see here. Okay, hide the floating control panel. There we go, perfect. All right, so oopsie, technology again. So yes, it's important to kind of think about that, especially to see who's showing up in your practice and what kind of natural healing they bring in. That is not specific to Chicanx healing or obviously Latinx healing, because indigenous healing goes, you know, is across the world and across the planet, but I'm specifically going to focus on this group. So in my traditional Chinese medicine practice, I did work with a lot of people who wanted to use a more natural healing. In school in Chicago, and a lot of Latinx and Chicanx people who came in with other herbs that they used, and we kind of crafted them and used them along with Chinese medicine to kind of help in their healing journey. When I started my master's in clinical mental health counseling 3 years ago now, wow, time's gone by really quickly, the pandemic, right? So, I mean, it's gone. So basically the 3 years I spent really kind of brought my worlds together when I learned about polyvagal theory. So as clinicians, we know about polyvagal theory and the vagus nerve and how our bodies react to stress, anxiety, and how it shows up physiologically in our bodies. So what does that mean? And how might people who are looking for natural healing and don't want prescription medication, how might they be pulling from those herbs? And we may see that in our patient intake forms. Some of them may say, do you take prescription medication? Are you taking any herbal supplements? And how those may be guides to working with clients and being able to say, hey, we'll go into details, but hey, why are you taking this herb? Or what's going on? I'm having insomnia, whatever the case is, that's why I'm taking this herb. And then you can further go into diagnosis in your scope in terms of insomnia, rumination, stress, and anxiety, but that will give you a little kind of jumping off point to be able to talk about what's going on and also recognizing their culture and what they do. So thinking about the mind-body experience and kind of being holistic and providing that holistic care. I found this to be true in internship. And sorry, I'm kind of going off a little bit here in the beginning, but in internship, working with LGBTQ plus people who are migrating and undocumented and looking for healing practices and are looking for ways to take care of their physical bodies and mental health. Sometimes it's difficult to find resources when you are undocumented and you are kind of in survival mode, right? So we're outside of that window of tolerance and we're just trying to make it work. So that's important to kind of think about that kind of population and really anyone in the Latinx community. All right, we're going to start the slideshow now. Oops, all right. There we go. So a little bit of objectives for the day or for the hour. So what is the significance of culture for understanding and treating Chicanx, Latinx mental health issues? So understanding the ethnopsychotherapy behind it and really what that means for you as a clinician and your clients showing up in practice. Also, how much weight should cultural psychosocial factors be given in developing treatment plans with Chicanx, Latinx clients? As we know, we wanted to create treatment plans with our clients to make sure that we obviously recognize what they need and what they require to heal and feel better, and healing practices that may show up in a therapy session. So herbal healings, different types of treatment and modalities. So we'll go into that a little bit as well. I'm going to start initially with, talking a little bit about Chicanx, Chicane, what is the term? So a lot of people don't know Chicanx and they don't know what that is necessarily. I know we're using a lot of Latinx terms, and of course Latinx, X can be problematic for a lot of people, which we're not going to get into in this presentation, but excuse me, so Latin is probably something that people will be using more. So originally it was a derisive term from Mexicans to other Mexicans living in the United States. The concept was that those Mexicans living in the US were giving up their country and moving to another country and basically leaving behind their culture. And they were now something less than the Mexican people in their country. So now they are less than the people who are in their country and on their land. And so there was a little less than, a little feeling of potentially, insecurity and not feeling comfortable.
Douglas, I'm sorry to interrupt. I think you're having some issues with the PowerPoint. We are only seeing the cover, the first slide. So it's not moving on our end.
Oh, no. Okay.
Oh, no.
Okay.
Sorry about the interruption.
No, you're fine. let's try and fix that. Sorry about that.
Thank you.
One moment. All right. Sorry, y'all, technology. You would think.
Now it's working. Oh,
is it? I know, yeah.
well, you're
That's
out
always.
now again. Sorry.
I know. All right, it's a journey, y'all. It is a journey. We will get there. It's fine.
We're here together. We're here together.
Absolutely. Honey, it is a journey. Okay, so we're gonna make it, I'm gonna make it a little smaller so it might be easier to kind of see the whole thing. But can you see that?
Yes.
Okay. And if
just
I move it.
Yeah, click on the next slide. Yeah, perfect. All right, you're good.
Perfect. All right. Okay. It's a little smaller, but we'll make it work, right? Perfecto. Bueno, vamos a seguir adelante. Okay. So, yes. So the little, quote unquote, little satellite Mexicans living in foreign countries, they were something small. They were chicos. They were now Chicanos. So they were not necessarily, they were leaving their country of origin and now living in the US. So that is something that they kind of carried with them. And of course, as you can imagine, that is not a great feeling to have and not a great thing to carry with you into a new country where you don't speak the language, you maybe don't have community, like all of those things, right? Stress and anxiety. So a little more information about it. I had to put in the Mexican pride flag as well, because yesterday was National Coming Out Day. So something to think about. So Chicano is a word initially popularized by older Mexican-American generation. So thinking about the term and expanding, more young people are actually using the term now, but initially in the 80s and 90s, there was a lot of, and so I'm talking about LA specifically, there was a lot of change and transition going away from that term and being a lot more, quote unquote, Americanized and a lot more assimilation happening. Not with everyone, of course, I'm generalizing, but there was a lot of that, and there was kind of a pushback. But initially in the 1960s, there was kind of a radicalized movement that was Mexican-American people, and they called it El Movimiento. So the movement, right, advocated social and political empowerment, the Chicanismo, and cultural naturalism. And when we think about that, it's like people who have moved into a new country who are now trying to find their footing, find their space, and not having access to healthcare, carrying the stigmas of leaving their country of origin, and now being faced with discrimination and from their own people and from the people in their new country, you know, and how that might feel. So as we talked a little bit about that, so there's the resurgence of the term Chicane, Chicanx. So a younger generation in the last, I'd say 2000, 2010, more people are using it, specifically in cities like LA and like Chicago that have a very large Mexican population. They tend to, excuse me, we tend to identify more as Chicanx, and we can, again, it's generalizing, but there is a lot more people using that term now, and Chicanx as opposed to Chicano and Chicana to make it more inclusive of gender. Thinking how does all of this translate into healthcare and mental health? So if you're thinking about people who are now trying to find their healing, find their culture and their community in the Chicano culture, and they're bringing in, oh, what did my grandparents use for headaches in the past or for insomnia? Let me do a little research on that. So they may be bringing that into session, you know, insomnia. So they could be people who go to church. And so that part of the healing process can be prayer. And we call that guided meditation, some of us, you know, and there's that similarity in being able to center the body. And so there is that kind of duality of using prescription medication and traditional medicine, conventional medicine, and also using more of a healing tea, tincture, natural healing, and that combination. And now thinking about generationally, so people may have a variety of access to these products. So, or to certain healing products, let's say herbs, excuse me. A person who is maybe a third generation Chicanx person living, it has insurance maybe, and has access to be able to see a naturopathic doctor or an acupuncturist for treatment because it's covered by their insurance. But a person who is undocumented and coming to get service and care, and they're used to el curandero that is from their, or curanderex that is from their neighborhood, then where do they find that in this new world that they're living in, a new society? And we'll talk a little bit about that as we go on, but thinking about the different generations, access to resources, financial limitations, sometimes access to natural healing is for the more affluent person who can pay $200 for homeopathic intake, or not necessarily for a person who is used to a natural healing modality. And so all of these things are things that people are to think about when you're working with your clients and sitting down with them. Obviously, quality of treatment and discrimination is something to definitely not, leave out of the conversation, because people showing up and maybe not wanting to see doctors because they've been treated poorly, or because they are discriminated against and not getting the care because they are, should be able to handle more pain. So whatever the situation is, and the discrimination that they face. So think of that. Okay. So why is it important to talk about this particular group? So we talked about it a little bit, and so the Chicanx people are specifically, Chicanx are of Mexican descent, but however, many Central and South American people use very similar healing practices, like I mentioned, and that's important to consider. So I'm using Chicanx only because I am Mexican, but I want to make sure that you all realize that it does encompass anybody who has indigenous roots, because that is our natural healing and natural healing processes come from our founding mothers and fathers and people who taught us how to heal ourselves when we didn't have traditional medicine or prescription, someone to write us a prescription. So okay, and it's important to know what your clients may bring into the session, especially if you're working in community mental health and underserved populations. So cultural identity. Just quickly, I'm working in community mental health at the moment, and I see a lot of people who I work with for mental health in community mental health organizations, and they come in talking about taking teas and herbal supplements because they don't know, and they're kind of timid about talking about it because, yes, I do speak Spanish, but I am Americanized, born in America. So there is that stigma that maybe I don't know about this healing practice. Luckily, I do have a Chinese medicine background. I was also raised by a mother who believed in curanderos and seeing curanderos growing up. So I carry that with me as well, and I can provide that space to have those conversations. Healing practices as well. So sobaderos, going to a sobadero for different things. A massage therapist, we think about going to someone for massage therapy for maybe, relaxation, but beyond that. And then generational trauma. So what are they coming to you for therapy for? And how can we provide a space where we're not further traumatizing them by maybe laughing at their healing practices or kind of shrugging them off as not necessarily a viable healing option for this population. And the stigma of seeking mental health. I will just share anecdotally a little bit. I talked to my mother about going to see a therapist, and she said, yo no estoy loca, ¿por qué voy a un terapista? Why am I going to go to a therapist? I'm not crazy. And I said, Mom, I go to a therapist. Do you think I'm crazy? She said, claro que no, of course not. Well, then we started to have a conversation about that. But there's that stigma that's associated with going to see a mental health therapist. And so there are many layers to the people who come and see us in practice and in session. And so it's important to kind of think about that in the back of your head. If you're not part of that community, really think about, okay, who's sitting here and how might they react to me kind of scoffing at taking an herb or taking a tincture, or what kind of face am I making? What's going on there for me that maybe is not necessarily being present for the client in our sessions. Integrative care. So many medical practitioners use integrative care, but what does that mean to this population? So we talked a little bit about that. So insurance and Medicaid, if people actually have that, may not cover traditional Chinese medicine or naturopathic medicine. It depends what state you're in. There's so many levels to access to care. And so that's important, So thinking about who is in your team, your referral team, your referral network to working this population? How are you going to have a list of people who you know are do cash only, do sliding scale, have that kind of in your back pocket so you can provide that person-centered care that we want that really can help with their healing process. Okay, so access to holistic care is often only available to people with a bigger disposable income. Acupuncture and naturopathic medicine can be very expensive, and it can be hard. And as a Chinese medical practitioner, you know, I understand that, and I know that it's important to have resources for people who, you know, for me, to have resources for people who don't have that access to care, but still need that healing process. And also, and if they are covered by insurance, are these integrative care medical doctors actually referring to naturopathic doctors, Chinese medical providers, curanderos? Maybe not, because to them, it's easier to just write a prescription, and no shame against medical doctors, of course. That's what they do. And there's space for all of us, right, in the healing journey of a person. But it's important to remember that maybe they've been shrugged off by medical professionals before, or just been pushed off like that's not going to work. And how does that affect them in their core and their foundation as people who bring in this type of healing? Natural healing options. So I talked a little bit about it. So green medicine, natural healers, traditional Chinese medicine, and Oriental medicine, because there is Japanese acupuncture and Korean acupuncture, as well as Chinese medicine, all kind of under that umbrella. Naturopathic medicine, somatic healing intersections, guided meditation, mindfulness, religious and cultural norms. So a lot of people who are religious do see a priest for therapy. And how might a person, if they come and see you and they're part of the LGBTQ plus community and growing up in their country of origin, went to see a priest who they happen to share with the priest that they were gay or part of the community, and they were told to suppress it, to not be who they are. And now they're potentially forced to see a therapist because they don't feel, for whatever reason, and they're scared now because they may feel that their therapist is going to tell them the same thing. And it may not be a space for them to be able to share who they are. So bringing all that into the session, you know, and remembering that, going a little bit back, going back to Chinese medicine, that is a 4-year master's graduate level licensed position. Naturopathic medicine is a medical school. It is licensed in most states. And there are, in many states, naturopathic doctors can prescribe medication as well. So depending on the state you're in, and Chinese medicine as well. So a Chinese medical practitioner in New Mexico can prescribe medication, and in Florida, you know, so it depends where you are. And so they can get the best of a prescription and also natural healing in an environment that is comfortable for their healing journey. And along the lines of using these as resources for your community, and as a healing team, right? Because we have a healing team for that that has their specialty and works in different areas. And the more inclusive that they are, in my experience, has been the better healing results that people tend to get. And now we're going to go into a little bit more detail about therapeutic modalities. So curandero, what is a curandero? Natural healer. And we're going to go to each one as we go along here, but hierbero, herbalist, sobador, massage, ventosas, fire cupping, which is, some of you know, Chinese medicine, fire cupping, but in Mexico, curanderos do ventosas, and that, which is basically the same thing. And we'll talk a little bit about that. So curandero here, natural healer. They basically provide, and this is not every curandero does all of the same things, but in general, they provide treatments that come from Arab and Spanish and Aztec influences. So it's a combination of all of these things. And the Aztec influences are the more indigenous influences, tend to be the herbal remedies that were found locally wherever the curandero tends to be. But if you can see in the images here, the curandero that is standing in the white top, she can be doing a cleansing, kind of cleaning that energy off of there. Some people use the word shaman. There is that part of it as well. There's the mind, body, spirit part of curanderismo. And then the small little caricature there shows kind of tinctures and herbs and more natural healing. Sobando, potentially providing herbs and salves for the natural healer. So the curandero is more of a holistic practitioner that may do herbs and massage, and also be their therapist potentially, you know, and using kind of all of those healing, because in smaller areas and smaller towns, the curandero could be the only physician in the area for, you know, depending on where it is, how rural it is. So that is their medical, that is who they are medically. And I mean, that is who they look to medically for support. Okay, hierbero, so herbalist. If we think about the Pacific Northwest, there are a lot of different, I'm just talking about that because I'm in Seattle at the moment, and I live here now, but there are a lot of different kinds of herbalists. So herbalism is not something new, obviously. It's been going around, it's been around forever, but it is getting a lot more traction, I think, and a lot more people are trying to turn into that more, I would say, in the last like 20 years, in terms of turning away from prescription medication because of the side effects. And not everyone, but there is kind of people who are doing that more. And so in the white square, you'll see that it's a traditional Chinese medicine formula. That is not a herbal formula from a hierbero, but it can be very similar. It's basically different types of herbs that are put together, and a tea is made. That you drink the tea. Basically, you can also make a tincture from this if you want it to be more topical. There can be a salve, making a salve using beeswax or any kinds of other healing. I'm using the same kind of topical herbs that may work for that. And tisana betel is a tea that you can find in different stores that can provide healing for a variety of different things. It does happen to work for depression for some people, but you can find it more commonly in Latin American stores. Patent pills are on there, and patent pills I found to be more Chinese medicine driven. So you'll see it's a lot easier for Western people to take herbs, because sometimes the teas, they don't taste great. I'm going to tell you right now, it's not. Sometimes it is not. You know, it's not a chai latte from Starbucks. Let's just say that, right? So it can be a little bitter. But the patent pills are a great way to tolerate that. So you're getting maybe not as strong of an effect as you would from a raw herb formula, but you are able to take it. So it's basically like bringing traditional medicine into what we're used to in terms of taking pills. So things you may see in your intake forms, or maybe discussed in session. You know, when we're having a therapeutic session, we're getting to know our clients. Usually in the first 5 minutes, we're talking about our day, or really they're kind of sharing different things with you that aren't necessarily therapeutic in nature, but they could be talking about, oh, you know what? Yeah, I've been taking this tea that is kind of helping for, so I'm a sex therapist as well. So thinking about, let's just say, palma enana, so saw palmetto. Saw palmetto is used for erectile dysfunction. So if I'm working with a client and I see that they're taking a sex therapy client who's having, maybe comes to me with issues related to connection or intimacy, or not necessarily feeling, being able to engage in sex the way they like, I may say, oh, I see you're taking saw palmetto. What are you taking saw palmetto for? Oh, well, I'm having erectile dysfunction, and this is something that I've been taking for a while. And so, oh, you can have that conversation, and then from there, as I talked about before, kind of jump into, oh, what's going on with that? You know, what's going on with the erectile dysfunction? How are you sleeping? How long has it been happening? When did it start? What makes it worse? I mean, kind of all of these things are a great way to have a jumping off point to have conversations with the clients, not necessarily prescribe any of these or give any advice on any of these because they're outside of our scope as therapists. But it's important to kind of see when people say, oh, you know, I'm taking, you know, oh, I found this great tea that's, you know, has valerian root in it. I just love it. I think it's amazing. Oh, really? You're taking valerian? Why is that? I'm having trouble sleeping. And so, oh, really? And then, I mean, it's basically a good way to kind of take notes and kind of see what's going on with your client and what may be going on. In the picture here, you'll see bags of different herbs. So Rino-san is basically for acid and your kidneys. So there's a lot of different types of herbal formulas here, and can be very traditional in a market in Sonora. So, it's very common to see it when you go to the grocery store or herbal markets. Sobadores. So if we're thinking about sobadores, a therapeutic intervention is massage. A lot of us kind of think about massage as like relaxation, or if we go to a physical therapist or a chiropractor, they may do specific massage to help release muscle tension, or work on specific musculoskeletal pain and issues. But sobadores also do other things, and midwives can be sobadores as well, which help with the reproductive cycle when a woman is pregnant, and which help basically reposition organs or parts of the body that are considered out of alignment. All of these things are things that we consider when we're treating this population, because we're not necessarily thinking about just going to like the spa necessarily. They're also doing other things. So traditional Chinese massages have been used to treat digestive issues, musculoskeletal pain, tendon or nerve issues, infertility, and to manage the effects of trauma on the body, mind, body, and spirit. So obviously relaxation, maybe there may be different points. Actually, in curanderismo and Mexican healing, there are points that align with Chinese medicine meridians and point treatments that do the same thing. And it's just very interesting how both cultures align and use very, very similar treatment modalities. And we're going to go right into that right now. So ventosas, Mexican fire cupping. If any of you have had fire cupping, it's amazing. I love it personally. It's one I use for relaxation. There, of course, there are other things that it's used for, many other things that it's used for. But initially, when you see the image on the woman's back or the person's back on the left here with the big red marks and big red scrapes, yes, they look like circles. But if you're doing moving cupping, it could look like big red bruising just along the person's back. If someone comes to see you with big red bruising, you may think they're being abused. You may think that if it's a child, because fire cupping is done on children as well, you may think that they're being beaten by their children, or by their parents. So knowing about different healing practices is kind of important, because we don't want to assume anything, but we want to be able to have a conversation. Oh, what's that? Oh, okay. Well, I was being treated because I've been really stressed out and my traps are really high. And so I'm getting cupping done on my traps to kind of bring oxygenated blood to the area, help healing the massage, or help heal that area and kind of bring it down a little bit and feel better. So these are things to consider specifically when we're thinking about the population in general, because we don't often think about cupping. At least I didn't for a long time think about cupping and Mexican healing. That wasn't something I necessarily knew about before I even started Chinese medicine. So what I call transitional healing practices. So the person may be transitioning out of more of a natural healing in terms of curanderismo, and now they have insurance and they're like, oh, I really want to see someone who can help provide herbs, but maybe at a different level, or change my treatment protocol a little bit. Do you have any recommendations? Prescription medication is one way to go, but if they don't want to go completely that route, going with a naturopathic doctor, an herbalist, supplements, so kind of being able to guide them into different resources that they can use. Grocery store farmacia, I put that on there because how many of us have gone into La Tiendita in the corner, or the supermarket that's around the corner that we go into, and you go and you buy your pan dulce, you buy your, suavitel, you get all your things, right? And then you're checking out, you look behind the person who's ringing, and you see different kinds of herbal modalities, teas, right? Different types of healing teas, salves, like really different types of natural healing that is behind the person who is ringing you up, right? Potentially. So that is something that is very commonplace in a lot of stores. And so people may not know that, they may not know that when someone who doesn't have access to healthcare may go to the grocery store to find that kind of resource and that kind of healing that they're used to from their country of origin. Okay, and then why are we talking about Chinese medicine? So I've kind of already covered this a little bit in terms of the why. It's important because there is a lot of crossover, and people have potentially, if they have insurance and they want to see someone, they may have more access to Chinese medicine or naturopathic doctors. And it's important to have that, and I keep reiterating that, to have that in your referral network, to have people who you can refer to, who can do things that are outside of your scope, but can partner with you to provide that holistic care for your client. Yeah. So it's just something to consider there. Okay, and just a couple of examples of what might be shared in session. Someone might say, I went to see my curandero for a ventosa because my nervios have been really bad. My shoulders have been so tense I can't sleep. Okay, so my nerves are bad. So my anxieties, nervios can translate to anxiety, having a lot of anxiety, can't sleep. Okay, so now you understand kind of what a curandero is and what a ventosa might be. I'm taking tisane betel because I have been so anxious. I feel like someone gave me mal ojo and made me depressed. So though, kind of knowing a little bit about that, what is mal ojo? So could be the evil eye, right? And some people may brush that off, but it's something that we believe in. Growing up, there were people who, when the babies were getting sick, they would say, oh, le están dando el mal ojo. Like people are looking at them too much. So they would take an egg and kind of cleanse the baby. If people are bringing that to you in your session, kind of thinking about, oh, there's different healing practices that people from indigenous countries are bringing to the US, and they're showing up for our help as therapists. And so it's good for us to kind of know where they're coming from. So yeah, if we're providing holistic care, we're meeting clients and patients. We call them patients in Chinese medicine, but clients as therapists, where they are, which means recognizing that they bring a history of healing practice that needs to be considered, as well as the amalgamation of traditional and natural healing. Like it is really, where did some of these prescriptions come from, if not from herbs initially, and just remembering that. I do want to say too, working in community mental health, we do work with a lot of nurse practitioners who do prescribe a lot. And I hear patients and clients who say, I don't really want to take a prescription. Quiero un té, I want a tea, I want an herbal supplement. And it's outside of my scope, so I don't recommend it in that way as a therapist. But it's, it's important to be able to refer out, to someone who can do that. Or you may want to talk to this person. They may be able to help a little bit, and I think they can be really, they would appreciate that. So final considerations, consider the potential traditional healing practices of your clients. Who are they? What do they bring into session? We talk about past traumas, we talk about past experiences and family structures and family units, but also thinking about the other side of that, the physiological healing and the mental health healing, because again, the stigma of going to a mental health therapist, they may use herbs instead of seeing a therapist. So, and then understanding that they may use modalities that may leave marks. We talked about fire cupping. Don't assume that it's an injury. Don't assume that it's, necessarily something that's been, the person's been injured in any way, and it could be their healing modality. And just being able to have that conversation and knowing what that is, knowing what the fire cupping is specifically. And they may be excited to tell you all about it and explain a little bit more about it. Let's see, they may want to use conventional prescription medication, create an inclusive referral network that you may be able to use to refer out to your clients and whatever your specialty might be. I did want to share these two books. I thought these two books are really great. The Curandero, Hispanic Ethno-Psychotherapy and Curanderismo is a really great read. It's a very easy read, has a lot of good information in it. And I think it's very accurate and can provide some resources for you. Also, Healing and Herbs and Rituals, that is it's super easy read as well, but it is very, there's a lot more nuance to that. I think there's a lot more shamanism and other things that may, if you're interested in that, by all means, check it out. But these two I thought were really great, and they might be something that you might want to check out at some point. And there's references, so I am going to stop sharing.